Hello guys, welcome to another anatomy tutorial. This is Muhammad Hashi, and in this tutorial I will look at biceps brachii, coracobrachialis, and brachialis. These three muscles are innervated by muscular cutaneous nerve. They are also all the muscles of the anterior compartment of the arm, and they flex the arm and the forearm as well. So let us look then. This is biceps brachii. Biceps brachii has two heads, the long head, the short head, and the long head. This is the long head. The long head originates the supraglenoid tubercle of the scapula, right there, supraglenoid tubercle. We have seen another tutorial that the infraglenoid tubercle, the long head of triceps brachii, originate the infraglenoid tubercle, but the long head of biceps brachii originate the supraglenoid tubercle, right there, and it join the short head, which is the green painted one. This is the short head, so they join together and insert the radial tuberosity right here. This is the radial and this is ulnar, so radial is the lateral side, lateral aspect. So the short head originate the anterior aspect of the coracoid process of the scapula right here. It's not the only muscle that attach or has insertion or origin point at the coracoid. Coracoid, in the medial aspect of it, pectoralis minor insert the medial aspect of it, and as we will see in a minute, the apex or the most inferior aspect of it originate coracobrachialis. So there are three muscles that has either inserts or originate from coracoid process. The inferior aspect of it, coracobrachialis, the anterior aspect of it, the short head of biceps brachii here. This is the green painted one. And biceps brachii in both heads flex the forearm at the elbow joint and supinate the forearm at the radial ulnar joint. It also produces movement in the shoulder joint because it crosses the shoulder joint right here. It's innervated by, as I said earlier, muscular cutaneous nerve, spinal cord segment C5 and C6. Even though the muscular cutaneous nerves contain C5, C6, and C7, it does not necessarily mean that all the segments innervate the same muscle. This is coracobrachialis. Coracobrachialis originate the inferior or the apex of the coracoid process of the scapula, inferior to the apex, and it inserts the middle third of the medial aspect of humerus right here. It does not produce any movement at the elbow joint because it does not cross the elbow joint, only at shoulder joint. This is where it flexes the arm, the elbow joint. Flex and adducts the arm at the shoulder joint right here. It's innervated by muscular cutaneous nerve again, C5, C6, C7. So as you can see here, C7, C5, C6, C7, all the three segments innervate the coracobrachialis, but not the biceps brachii, only C5 and C6 segments. Lastly, brachialis. Brachialis is a pure forearm flexor. It originates the anterior aspect of the distal half of the humerus, right here, the distal half of the humerus, and attach to the coronoid process and the coronoid process and tuberosity of ulnar, as you can see here. It does not involve any supination or pronation. Why? Because it's the radius that supinate or pronate over the ulnar, and this muscle does not attach to radius. It only attaches the ulnar, so that's why it's a purely forearm flexor. It innervates again muscular cutaneous nerve, spinal cord segment C5, C6, and C7. That's it for this tutorial. These three muscles that are related. In each tutorial, I will focus on the group of muscles that are related, either have common insertion, common origin, or their function that are related, meaning they perform the same action, or they are innervated by the same nerve. So in that way, it's easier to remember when you group them, and that's the same strategy that works for me when I was studying those muscles. See you soon, and be sure to subscribe the channel.